I'm Kara Zivin, and I'm a professor of psychiatry here at the University of Michigan. We are trying to build an interdisciplinary group of researchers, clinicians, students from across the university. So that could be anything from medicine to public health to arts and sciences. I work at the population level to address issues of public health interest that span across specific diseases. How health policies affect women's careers, how it affects their health, how it affects the balance between work and life, focusing on women's mental health. The university strongly supported women's health rights and have not been wavered in any way about that, on employee engagement and well-being and dealing with burnout and the intersection of public health, mental health, and public policy. It's really important for us to understand how policies affect our access to care and our health outcomes. I lead large grants and publish scientific papers on access to care, quality of care, and costs of care for individuals with mental health conditions. We're also trying to bring together issues of both data and story because we believe that it's stronger to have data to support the stories. Having had healthcare challenges that I've dealt with here at the University of Michigan informs my research because I can imagine what it's like for an individual patient to be dealing with health challenges, combining that with policy recommendations for how to help women in those circumstances. So I felt like, in that sense, I was bringing together the creative and personal experience with data and science and policy recommendations. Now I'm in a position where I can try to build relationships outside of medicine or even public health. And so I've been trying to combine my scientific writing with personal narrative. I realized I wanted data and policy to back it up, and so I continue to pursue that both personally and professionally, to build a community that brings together data and story. So I'm trying to get this interdisciplinary discussion going. I would like us to have some of these conversations, and I have found that when I do, other people say, that's helpful. We don't talk about that stuff enough. That's become really important to me in my career. I think it's both the personal accomplishments of feeling like I've created a piece of work that I'm proud of, but also working with a range of people from different backgrounds and different types of trainings to help to support their career development and help them achieve their goals. To build a lifelong career in academic medicine research, it takes a lot trying to figure out how people can balance having a research or clinical career and a personal life, and what are public policies that can support those types of endeavors. So we can look at the evidence of how a policy might improve access to care or decrease access to care, and those have health consequences. So if you can't get access to the types of providers or types of care that you need, that can lead to downstream worse outcomes. And so we're trying to understand patterns and practice and where we could make a difference, where we might be able to inform new policies or adjusting existing policies to help individuals have better health and better quality of life.